point, sorry, Katie. Yeah, I should have mentioned that. Another problem, Geetha, is that like we don't really know what everybody's doing in terms of physical activity and nutrition. We have some idea because there's some federally funded initiatives like I'm thinking of WIC or Nurse Family Partnership, or a lot of like Johnson County implements the diabetes prevention program, right? But like those things are around, but we don't have that written down anywhere. Other people often don't know. So like I've been in public health forever, and like I couldn't tell you what they do in the North End, you know?
Yeah. So I don't know who is the person who would be able to connect the two, because I do all day long obesity clinic and I see how the two things are intricately connected and complement each other. Crappy nutrition means more pain, and then they don't want to exercise and do things if they have pain and inflammation. I'm talking of the older population, not the school kids, but I think this applies to any group. So that's where I think even if we can touch the two or somehow weave the two programs together, or have somebody talk a little bit or remind people how important it is. And I know now the social determinants of health and food insecurities is a big thing. And that would really help, I think, get the best outcomes for all our patients and clients.
Yeah, Geetha, I totally agree. Go ahead, Sandy. You were gonna say something?
Oh, I mean, the only thing I could say is with the WIC program, we focus on screen time. We talk about screen time for little kids. And part of that is, getting them more physically active, but yeah, that's as far as we go with that, but they're definitely intertwined for sure.
And as it has been shown with behavioral changes, you have to constantly reinforce at every visit. Even if we talk about it briefly, I think it will have some meaningful improvement over months and years. So that's where I think if we all even briefly say, hey, have you been keeping up with your exercise, or just touch base on the guidelines. I know all of us are not comfortable counseling on the same things, but just even reinforcing the guidelines in one or two lines can hopefully make a difference and remind people it's important to do both, not one or the other.
Yeah, and I think at the individual level, that's totally true, Geetha. I'm thinking as in public health 3.0, health departments are moving to this like health strategy model where the health department individuals are kind of the leaders of health strategy. So they don't interact directly with clients or patients or community members on kind of that level of like reminding them to be active and eat well. But they're setting up the system, whether that's like policy systems, environment, to like make it so that everything else works. Does that make sense? Help me out, somebody else.
So wondering if you remember, Dr. Tilk had come and done a grand rounds for us in lifestyle, and she has incorporated some of this in her YMCAs and the medical school there. Again, I don't know the details of how it is part of the community health, but I know they got a lot of funding for their YMCAs. Something along those lines, or people like that who are doing it and have had success, might help us go in the same direction or do better.
Yeah, totally. And Dr. Troke has done a ton with exercise is medicine, right? And I think that model is cool. I think that we're talking about something a little different where it's like exercise is medicine has really been used well in healthcare settings, and integrating like exercise curricula or physical activity curricula into medical schools is valuable. But at the health department level, the public health level, I think how do I say this? There are foundational public health practices. Chip Chaw, public health planning, assessment and planning is a foundational public health practice that's mandated by accreditation, that's often tied to funding that, health departments and nonprofit hospitals have to do, right? So at the systems level, this is kind of where we're thinking. And if we can get these people at the systems level to talk to one another, number one, that's goal number one in my mind, right? Can we just get everybody in a room and like get them to be like, oh, we're doing this and we're doing this, we're doing this, right? And then thinking about like physical activity as a mechanism of change for obesity, for transportation, for social determinants of health, right? For crime and violence, like obesity is key, right? I mean, Mikhail Foucault, and like biopower and natural surveillance and all those things tie in well with physical activity promotion. So So Katie, what we're thinking about, guys, is having, just a couple hours where people can get together after the quarterly meeting, maybe pay for lunch or something, and get people, talking. So I think this is where we're going. And happy to get feedback on like what an agenda looks like, who we should invite, right? So DC Sandy for Johnson County, who should be there, I'm happy to like reach out to Casey Moe. I think we have some contacts in the Northland that we can chat with, um, and we can like send it out to emails. But if we want to do any targeted recruitment of like who should be in the room to talk about their community health assessment and community health improvement plans. I don't know, Sandy, DC, I don't know if you guys know anybody from Advent. I don't like get down there at all, ever. That's not my, thing. So thinking about who we should invite to really like move that stuff forward, I think is really key to making this successful. Like
Yeah.
Geetha, who at University Health does the implementation or the CHNA and implementation strategies? Do you know?
I don't know, but I can look into it. And
Okay.
if you'll send me, I
Yeah.
am not familiar with these acronyms, so you'll have to send me an email with those details, and I
Yeah,
can definitely look into it.
I think it used to be Nikki Donawa's team, but I can't remember who it is now. So yeah, I'll write it up and send
Okay,
it to folks. Yeah, to
thank
start
you.
with. Sandy, you were gonna say something. I'm sorry.
Oh, I was just gonna say, I can definitely talk to Barbara, and see if she has any contacts with Advent. I'm not sure, and also the CHIP committee.
Yeah, I mean, and having Barbara there or any of the committee members would be super helpful, right? Yeah, make sure if we forget to invite Barbara, will you just make sure that she gets an invite, Sandy?
Yes, ma'am. Sir.
Oh. No, you're good. Don't worry. I just no. Cool. Awesome. Okay. So how to move that forward? I guess the question is like, do we want to pay for lunch? Do we just want to have a meeting? Do we need snacks? If we need snacks or food or anything, we need to ask for some money, which we can totally do. But what do you guys think? Do we need to pay for lunch? I don't know if we do. Is in person or online better for folks? You think we would get more participation one way or the other?
I think hybrid always works.
Yeah.
Yeah.
Hybrid is better. Yeah.
Hybrid's tough in a meeting room. That's the only thing. Like, so I'm thinking Katie at Kauffman Center. Like, do they have the technology to have a good discussion with folks?
I'm trying to think of like how we handle the quarterly meetings. Usually we do have a hybrid option, but when it does come to those group discussions, especially if we were to break off into smaller groups, I think that's where we'll have issues with. I'll need to follow up with Natalie as she's usually in charge of like our virtual attendees during quarterly meetings, and I can get her input on how best to handle that. But I don't see it being a problem. It's just going to come down to like there's going to be some limitations, obviously.
That's my oh, sorry. That's my issue is so our school, FYI, so you guys know I live in Puerto Rico, right? So our school, when we have meetings, everybody's just in their office, like on Zoom, because it allows for this kind of communication between folks. But when there's people in a meeting room, then oftentimes the people in the meeting room's voices are amplified over the participants who are online. And I don't want that to happen because I don't know. Why don't we, I mean, do we have time to think about, not really, right? We're gonna have a meeting in a month. So we need to make some decisions today on if it's hybrid or in person, or, I mean, we could do hybrid or online, right? That's kind of the options. Honestly, if it were me, guys, I would prefer like online only. And then because I don't want people, to like feel excluded. I don't know. Anybody have thoughts on that?
it would be easier to plan a virtual meeting rather than a hybrid option. So,
I think if you have to choose between virtual or in person, the virtual would probably work better for most people.
Like, Shanette, you're shaking your head. Would you agree?
Yes, I think virtual works best for a lot of people. It worked better for me.
I mean, I agree, right? But okay. So Katie, I guess we don't need money for stuff. We can just set the date and do some invites and get it on everybody's calendar. And so for an agenda, this is what I was thinking. If it's a 2-hour meeting, right? This is what I was thinking for an agenda. If we do introductions, so kind of who's in the room, right? I think we should give everybody like 5-ish minutes to go over their either priority areas or, you know, their chip or their implementation plans. You know, and really like ask people, well, like let's not Joey talk about the importance of you know, chip chop stuff. Let's let people talk and then kind of see where the conversation goes organically. And then at the end of the day, kind of how leaving with questions of like, how do we incorporate physical activity assessment into like the CHA and CHA or CHNA process? I think that would be a really good step. And then I think we need to do like biannual, every 6 months. Is that biannual? Updates of like CHA chip involvement, right? Like see what happens organically and see if like, you know, Johnson County can work more closely with like Wyandotte or something, right? Jackson County, KCMO, University of Health, they should all be kind of getting on the same cycle of like CHA chip stuff. And if that happens, great. But if we can just keep people engaged once every 6 months to be like, oh, this has happened. This is where we're at with our CHA. This is where we're at with our chip. You know, this is what we're focused on. I think that that would lead to some synergy across jurisdictions. What do you think? Is there anything else we should include on the agenda that, or a different structure of the agenda? I'm working on my awkward silence, guys. I hate awkward silence, but I'm working on it. So I'm just gonna let it sit there. I can't do it. Any other thoughts or comments on an agenda? All right, Geetha, I'm going with it.
Yeah, I'll have to read up more about it before I can give any thoughts or comments. So hopefully I'll send you some if I think of anything else before the meeting.
How about this? So we have Shanette and Isamara. You guys aren't in traditional public health roles, but you are obviously doing public health. So how do we incorporate, you know, part of the CHA chip process is really engaging stakeholders and community members, right? Like you guys. How do we incorporate your voices into a meeting of like CHA chip, you know, community health assessment, community health planning, so that people really understand, hey, this is where we want to go. And you guys have the capacity, the capability to really implement things, right? In like this public health 3.0 model. How do we get your voices at the table?
I'm not sure. I am a community health worker, but I'm also a research coordinator, and I just started recently. So I'm just learning about all of this and all the acronyms and all the organizations. So I don't think I have a lot of feedback right now. I'm just here to learn. And also just I want to like I found your page because I was finishing my bachelor's this semester, and my professor just told me like, hey, check this out, and I want to do something on my own, not like through a organization. So I'm not sure how to help. I'm just here to learn right now.
That's great. Where'd you graduate from?
KU.
Oh, congratulations.
Thank
That's
you.
awesome.
Congrats.
Yeah,
Thanks.
yeah. Well, and KU Med's a great place to work. That's where I did my postdoc after I got my PhD at KU Med. So,
Okay.
yeah.
But yeah, if I have ideas, I will let you know.
Okay. I do think that we should somehow incorporate like your voices, right? You guys are the people on the ground actually doing stuff, right? The public health people, again, we're the strategists on like, thinking through systems and policies. And so how do we get the voices from folks who are actually doing the work?
Mm, well, something that I do twice, maybe 3 times a month is go to tabling events. And I'm not sure if that's like something we can do. Do we want to talk to like who are we talking to again? Sorry, what kind of people?
Yeah, so these are like, I mean, essentially mid-level managers from health departments, and these are it's like not senior executives from hospital systems, but like executives who largely run the CHNA implementation strategy stuff at hospitals.
Hmm.
What is our goal of targeting them in terms of audience? What are we?
I mean, I think that it's the people who are doing the work at the health departments and hospitals in terms of like I'm thinking like of Barbara Mitchell at Johnson County, who has managed the CHIP CHA stuff. She does the CHA too, right? For 20 years, 25 years. So she would be like the person at Johnson County who really needs to be at the table, and then any auxiliary folks who are kind of in that space, right? At KCMO, it's probably like the Health Commission liaison, my old role, right? And maybe the person who's running, I think they have a CHIP committee for their on the Health Commission. At hospitals, it would be like the person who manages the CHNA, and it wasn't Nikki Donawa, but it was like somebody from, and I'm trying to remember, Geetha, who it was. I have to, it's because it's been years, but at
Sure.
CMH, it was, help me, Katie, who did it at CMH? She adjunct at UMKC, Margot Coney.
Oh, yes. I was thinking of the new person. I forgot about Margot.
Yeah. Margot did it for years at CMH, right? She ran the CHNA process. And then at hospitals, it's a little weird because there's like this community health needs assessment process that generally somebody like Margot runs. And then the implementation strategies are often done in the C-suite, right? They're like, oh, this is what we're going to report to IRS.
One of our associate deans, Stephanie Ellison, she does a lot of work with students and community walk with the dog and other activities. So I'm thinking reaching out to her, we'll get a lot of people she might be able to recommend or ideas and suggestions. And I know she's a part of this group and attends some of the forums, but I always reach out to her, and she is full of resources anytime you ask her for it. So I think I can check with her if you want and see what she has to.
Yeah, I worked with Stephanie. I wrote my first grant with Stephanie back in like 2017.
Yeah.
Yeah. So, okay, go ahead. Sorry.
Sorry, I was going to say, Geetha, I can also reach out to Stephanie. As you pointed out, she does work with us a lot in our different sectors. And as part of the Just Walk implementation group, I'm usually in contact with her frequently, but I love that recommendation. I can reach out to her.
Perfect. Go ahead.
Thank you.
Mm-hmm.
Okay, Katie, so we'll keep working on the agenda, but we can get like save the dates out and like, set up meeting rooms and do that kind of stuff, get it on people's calendars kind of thing. And then we got to think of like the list of folks. So you and I can work on that. But if anybody has anybody that we should invite, please either put their like names in the chat or send their names to Katie, and we can also follow up next month. So Katie, if we can put that on the agenda for next month to follow up on, you know, recruiting folks for that meeting, that'd be great. Cool. Anything else on that? We have a couple other things that Katie and I want to talk about. Awkward silence. It's so hard for me, guys. You have no idea. So Katie, will you talk about what you were thinking earlier? You did such a good job of explaining it to me, and I think you would do a better job than me of explaining it to everybody else.
Oh gosh. I don't know if I could. So we're talking about small group implementation projects, right? Okay. So some of our other sector groups, we've kind of taken that next step approach to like, you know, how do we advance these strategies and tactics forward? So healthcare would be a great example. We have our curriculum group, we have a Just Walk group, and we have a billing and reimbursement group. Well, our school sector group had just written an actual application proposal for funding related to swimming. And so that got us thinking, like, what are the different policies around like safety around swimming or swimming in school settings in Kansas? And I'm trying to like give you the backstory to explain what the idea is. And that kind of brought us into this policy focused idea for the school work group. Well, this is the public health sector, and I mean, it's part of our strategies is working on policies. And so it got me thinking and speaking with Joey, what we could do as this group to kind of focus on similar work. And so Joey and I had a discussion around maybe 3 ideas around advocacy, policy recommendations. Oh, my bad. So advocacy, surveillance, and research. And we wanted to bring it to the group to get your opinion. And within this, the whole point is looking at these 3 subgroups to answer the question of what is the role of public health in the metro for physical activity. So we just wanted to get your thoughts. Does this sound like a good idea to move forward with?
So
Joey?
I think, yeah. So I think putting in this into like, Katie, you did a great job of explaining like this like abstract idea of like what this is. But in real world terms, I put a couple links in the chat. You know, our team has written like national policy for APHA, American Public Health Association. And it is kind of the policy of the land, right? And I think, you know, this group can really put together some policies on like health equity and physical activity, or the need for like a policy on like how health departments should be focused on physical activity, right? It's the viewpoint of the Healthy Lifestyles Collaborative and the Kansas City Physical Activity Plan that health departments are essential to improve physical activity and improve health and health equity in the metro. Here's how and why, right? So if Katie, can I share my screen? Yep. So if you look at these policy statements, you know, there's an abstract, there's all this stuff, but essentially like, here's the problem, right? Like people are inactive, this are all these things. Here's the evidence-based strategies that we all know need to be implemented in Kansas City, right? And this is just an example, right? This policy statement's on, you know, supporting physical activity in schools for all youth, right? Amanda Grimes, Tyler Prochnow, some other folks worked on this one and got it passed. But here's the evidence-based strategies, right? Here's some like opposing arguments. I don't know if we really need this stuff. We could put it in there. Alternative strategies, and we focus on like, you know, physical activity isn't only important in schools. It's also important like before and after school, and increasing active transportation to and from school for kids, recess, etc. Right? But at the end of the day, here are the action steps, right? Schools and school districts should engage in collaborative efforts to share the results of successfully implemented physical education programs, right? So other schools can learn kind of what schools are doing. So this is just one example of what a policy statement could look like. But like, you know, I think we can, I mean, the wealth of information on this team of people who know stuff and who know what works for Kansas City is really essential, right? And what works for public health. And so how do we kind of use our experience and put it together so that we can encourage kind of like leadership at health departments to focus on physical activity, for hospital systems to interact with public health departments to focus on physical activity, all of the things. I mean, we could write a policy statement up on chaw chip stuff, Katie. That would be a good first step, right? But like, we should all work collaboratively on the same cycles, because these 3 and 5 year cycles are a mess, in a metro wide. Maybe we do that, and we could present that at the meeting, Katie, vote on it, and then move it up the chain. I'm sorry, that just came to me. I was not prepared, guys. This is what happens when you put me and Katie in a room. We like start thinking about things. Well, so
Yeah.
I guess the question that I have is, what do you guys think about that? Do you think it's a good idea for us to kind of focus on like drafting policy that then we like share with people, and then we put it in a database and say, here's what we think as experts in physical activity in Kansas City Metro. These are the things that we think we need to work on. 1, 2, 3, 4, 5, and we've done that kind of in the strategies and tactics, right? But we haven't really like said, health departments, you need to incorporate physical activity into your chaw chips. Hospital systems, you need to work with health departments on community health assessment, community health planning. Schools, you need to do PE. Like, duh, like these things that like, anyways, I can go down rabbit holes all day long. What do you guys think? Keitha?
Yeah, I was looking at a HEAL program. I think I put the link in the chat there. So while we do the policy, would it help if we give them a set short 8-week program to implement in multiple cycles throughout the year? That way they have a structured plan. Whoever uses this, then you'll have the data to see, how often it was used, how you can do before after surveys, enough to make a justification for implementing long-term and in multiple facilities, and give them the same standard, protocol kind of thing, easy for them not to have to recreate, reinvent things, and just apply this wholesome, or even we provide facilitators like HEAL has done. If we have some trained people, or give them training for 1 or 2 sessions, just enough to implement it. Something along those lines. Again, this is a rough draft of my thoughts, literally as we are talking. So
Yeah, I think that's a great idea. And I clicked on the link and it looks like the link is broken, but I
You need to
think
get rid of the
that,
dash at the end.
oh, okay, thanks. I think that it's a great idea. And I would recommend like, this is dissemination research, right? So here are the, 5 evidence-based practices that the Healthy Lifestyles Collaborative recommends for school-based physical activity, or for active transportation, or for ... right? And then like, here's the evidence, and that's what we're good at, right? We're all public health, really smart people. We're good at being like, here's the things that work. Here's the things that health departments need in order to implement physical activity. Share that. That's dissemination research. I love it. Sandy, you're shaking your head, nodding. I guess not shaking your head, nodding.
Yeah, I agree.
Other folks?
How deep will we go? Because I know a lot of physical activity, especially in the city, is based off of infrastructure, safety. So are those policy recommendations that we would make? Because, making sure sidewalks are fixed up, making sure there are parks, green spaces for people to do their physical activity, making sure there are well-lit spaces, making sure that, places are safe for someone to go walk or jog in their neighborhoods. Those are big pieces of just being able to implement physical activity conveniently. Not to mention, like, is a gym close by? Because more often than not, if you're living in the city, there's not a gym that's close by. You have to drive somewhere to get there. So
Yeah.
it's also making those kind of policy recommendations too. And I don't know how deep we want to go with that. We should go that deep.
Yeah, agreed. And I think, you know, my goal, my students call me very pragmatic most of the time. And, you know, my thing, DC, would be like, yes, absolutely. Like that's an issue. And how do we get that changed, right? So I see like a policy on urban planning, right? Like urban planners should 1, 2, 3, 4, 5, like plan for resources for physical activity, including sidewalks, parks, trails, blah, 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 right? Urban planners should plan for street lights and into, I don't know, improve safety and those kind of things. Like really putting like down what are the specific things that this audience needs to do in order to improve physical activity. That's great. Or like a policy on crime and physical activity, right? No wonder why people aren't active if there's crime or deleterious like blight in the neighborhood or all that stuff, right? And really like highlighting that physical activity is not often about physical activity. It's about these other things, right? And so who that message goes to and how it's used, I think is really, really an important thing. But yeah, how do we disseminate evidence-based practice? It doesn't matter if it's crime, if it's built environment, if it's schools, if it's healthcare, right? Who's the audience? Who has the power to change stuff? What are the evidence-based practices that we know need to be implemented, right? How do we like put that on a piece of paper and then send it to folks to be like, urban planners in Kansas City, you have to do this. Police officers, stop pulling people over for running down the street, you know? Like the things that really are happening. I think I enjoy that stuff.
This is new to me, but again, I have a question. What are the current guidelines? If we see the current guidelines, maybe we'll know why things are not successful and what we can tweak up right where they are. And then, of course, build on all the things you have said. Sounds really amazing. But where would we find the current guidelines for urban planning, or who makes these guidelines and how do they approach it?
Yeah, great question. Like urban planners, I think they do have some guidelines, but the process is guided for urban planning, right? So when you develop like a comprehensive plan for a city, there's a process that is set out by the organization that manages urban planners. I forget what it's called. But urban planners, there's a lot of discretion in that, right? So when they go through that process, oftentimes, you know, people come and they say, the cyclist, the squeaky wheels, right? They'll come, they'll be like, we have to have bike lanes on every single street. And often the reason we get bike lanes is because cyclists will show up, you know, in order to get stuff done. And they can be, I am one of them, right? My bikes are literally on my wall. And we can be a thorn in the side. And that's what it takes to get stuff done, you know, which is a pain, but.
Yeah, because I drive by an area now, in the Overland Park area where there's plenty of fast food restaurants, and 24 suddenly popped out in the last 6 months. And I'm like, they haven't even set a block of space. And this is right next to the Children's Mercy Hospital for parks and recreation. We really needed some park recreation space for people to move. Instead, there's a ton load of fast food places. And it's very frustrating to look at all those cement buildings instead of something that would be helpful for the kids. I mean, this is right next to a children's hospital. So, I'm like, where is urban planning in this?
And so how I see this working is like DC, take on like crime and physical activity, or urban planning or built environment or whatever it is kind of is your niche area that you know a lot about and are passionate about it, right? And then like we could probably put together an outline of what all of our policy statements should look like, based on, I mean, we could probably just use the APHA format, not as detailed or not as, long, but and then what are the outcomes that we want to see happen? What are the action steps for specific people, for specific groups? And then like, we could talk about it here. It can go, we can vote on it. And then I'm guessing Robin or nobody has like weighed in on this, which is, you know, whatever. But I'm guessing it should probably go to the core work group and then get voted on by everybody else. And like as a, you know, the public message of the Kansas City Physical Activity Plan. Geeta, you could work on one for like hospital systems or for physicians. Physicians, oh God, we could get more physicians to be like screening for physical activity, doing exercises medicine, talking to city council members or urban planners about the need for physical activity in cities.
That's what I'm working on. In fact, we just added, Jay and I added a part on screening, introduced it to med students to start early on and catch them young, to practice these screening tools on physical activity and nutrition just last year. That is one of my areas I'm really working on.
I love it, right? That's the kind of stuff that we need to share with people, is that like, this is what we think this group of people should be doing in order to improve physical activity. What do you guys think? And that is on policy, but do we want to talk about like research or anything, Katie? Surveillance research.
Why don't we save that for next month? We'll start small. We'll focus on one group at a time. Does that sound okay?
I think that sounds great. And do you think you and I can put together a quick policy statement on chaw chip stuff?
Yeah, I was gonna see if you have like 5 minutes after this meeting to talk.
Yeah.
Cool.
We'll lead the charge, right? Hoping that other people will follow up with important things that need to get done too. Cool. We only have 7 minutes left. Katie, what else do we need to work on today?
I don't think there's anything we need to work on specifically. I have some information I'd love to share, but prior to me doing that, I'm going to open it up for the next 5 minutes to the group to see if anybody has any updates they'd like to share first. So this can include activities that your organization's hosting you'd like to share. Maybe you're working on a paper or something that we could post in our monthly newsletter or our sector newsletter. Sorry. Additional questions. Yep. Okay. And then yeah, sorry, I got distracted, but I'll leave it open to the floor now.
Just an update. Last year, we started a lifestyle medicine interest group at UMKC for med students. The numbers have grown, over 50 students now. They actively are involved in promoting various lifestyle pillars of nutrition, physical activity, and things like that. They do work with Stephanie on the Children's Mercy gardening project, walk with the dog, volunteering at Harvesters. So these have been some of our activities that we have incorporated and hope to do more in physical activity and stress management coming up. We have also introduced a mindfulness in medicine program for the med students as an elective last year with Dr. Chris Sullivan and actually Children's Mercy, I'm blanking out her name, Jody Jackson, the neonatologist. She's heading the program, and there's been great response from students. It's a highly selective program with only 12 students accepted, a year-long program for mindfulness. And that includes a lot of sessions on stretching, physical activity, body scan, meditation, and other components as well. So those are two of the new things we introduced. We do have a culinary medicine certified physician now, who is also part of the lifestyle medicine interest group, and she's been incorporating some culinary medicine stuff in this group activities.
Good work, Geeta. And FYI, Geeta presents to the Hypertension Echo every year on GLP-1 inhibitors and like lifestyle medicine stuff in general. And she always does such a great job. So Geeta, it's great to see you again.
Oh,
always.
Thank you. I enjoyed that session.
Yeah.
Happy to do it again.
That's a fun group. That's I facilitate this Hypertension Echo, guys, and it's a fun group because we have like folks, the practitioners who come in and provide such great information.
Mhm.
Well, I was gonna share something for North KC. I know they mentioned this at our last meeting, and I apologize, I can't seem to find the PDF of the flyer, but they're hosting a family fun day Saturday, September 14th, and they're encouraging healthy lifestyle behaviors, but it's open to the entire family and it is free. I'll probably put it on our newsletter, just something I wanted to share from them. And also, Northland Health Alliance is also hosting their visiting session for their chips and chaws, just related to what we were discussing previously on Monday. So I'm going to attend and I'm hoping to come back with maybe some ideas for how we can host our September meeting. Okay, well, if nobody has anything else to share, just like Joey, I'm not good with silence either, so I'm gonna move on. Some updates from the Kansas City Healthy Lifestyles Collaborative. So we, as some of you may know, we recently, as part of our media and communication sector, launched a physical activity campaign called Move Together KC. Well, we haven't officially launched it while we've been posting and stuff. So we actually have a date set for an official launch, which is July 15th. So that's pretty exciting. We're asking all of our partner organizations to participate on this day specifically, and either by filling out a press release form, so we have templates that are included on our website you can fill out, or by tagging us with the hashtag or the @ symbol on social media, and we're calling it a splash day. So we'll be resharing everybody's information that they post on social media, so Instagram and Facebook. And if you tag us, we're going to reshare, and we're just going to be blowing that up all day to help spread the word about Move Together KC. And I will put a link in the chat to this press release template. If you have any questions, or you do want to share this with your communications department to fill out this press release, and if they have questions, feel free to share my contact information. I'm more than happy to answer anything. I'm such a slow typer, I apologize. Let me put my email in the chat. There we go. Go ahead, feel free to email me. Last update I have is about the quarterly meeting that we had discussed previously. So we have a save the date. It's September 26th. It is from 9 to 11 o'clock. So keep that in mind for when we continue planning our meeting for after this quarterly meeting. While we don't have names of our guest speakers just yet, this will be around the Kansas City Reach project and just some of their groups sharing updates about the progress that they've made in relation to this grant work. That's all I have. Besides that, it's just the next meeting, which is moved. So typically we host meetings on the 3rd Thursday of the month, but due to just scheduling conflict, we are going to host it on July 25th instead. And so I will put a link in the chat for anyone who would like to register in advance. And it's 1 o'clock.
And it is 1 o'clock. So I want to respect everybody's time. Have a good day, everybody. It's great to see you all. Great work moving everything forward. And we'll catch up in a month or so. All right, take care, guys.
Thanks. Joey, I'm gonna have you stay on.
Yeah.